Okay. Which hormone suppresses spermatogenesis without affecting testosterone secretion? Put your answer in the comment section. Let me give you options. Gonadotropin releasing hormone, GnRH, testosterone itself, inhibin, luteinizing hormone, follicle stimulating hormone. Which one suppresses spermatogenesis? Answer in the comment section. Okay, let me give you another question. Dash stimulates the interstitial cells of the testes to secrete dash. Luteinizing hormone, estrogen. Luteinizing hormone, androgen binding protein. Follicle stimulating hormone and androgen binding protein. Gonadotropin releasing hormone and luteinizing hormone. Luteinizing hormone, testosterone. Which one? Put your answer in the comment section below. So, which of the following is an androgen? Estrogen, progesterone, testosterone, luteinizing hormone, and FSH. Which one is an androgen? When do the testes start secreting testosterone? Is it in the first trimester of the fetal development? In the first trimester after birth? In the first 3 years after birth? In the first 3 years of adolescence after the first ejaculation? I want you to tell me. Put your answer below in the comment section. So you're welcome to my channel. My name is Dr. Nchebe. I'm here today to discuss reproduction with you. This reproduction is specifically for college students, for people preparing for their board exams like NCLEX, USMLE, and for people that wants to gather more knowledge in terms of concepts. Reproduction is very, very important because there's no board exam that you won't have a bulk of reproduction questions. Same thing goes with college questions. That's why it's extremely important. Even in our normal life, it's very important because without it, how can we multiply? So today we are discussing basic concepts. I want you to take your pen and paper and go along with me. This video, I'll make it very short, at least an hour plus. All right? After this video is for you to be able to prepare for your exam. So I will recommend you watch this video a day to your exam or 2 days to your exam. All right? And catch those little concepts as fast as possible. It does not replace your schoolwork. It does not replace your school slides. No, it doesn't. All right, so back to the basic concepts. Sexual reproduction involves production of gametes, which is the sperm and egg, genetic males, XY, females, XX, and they have primary and secondary reproduction. Okay. So fundamentally, male and female gametes combine their genes to form a zygote. All right, that's a fertilized egg. The sperm is motile from the male, and the egg is non-motile, but it contains nutrients for developing embryo. So this is what we call symbiotic relationship. All right, very, very, very important. And mind you, anyone that is lacking a Y chromosome is a female, but anybody that has a Y chromosome is a male. It's as simple as that. So male reproduction specifically is to produce sperm and also to introduce it into the body of the female. All right, through copulation. Female reproduction involves the production of egg and the reception of this sperm, thereby providing this an environment for the union to nourish and to grow, which leads to the offsprings. Very important for you to put in mind. Also, I need you to know that, the primary sex organs, that's the gonads, specifically the gonads, they produce what? Gametes. So gonad produces gametes. Example of gonads for males are the testes, for females, ovaries. Now we have the secondary sex organs. Secondary sex organs for male, the systems of ducts, glands, that deliver sperm. For female, there are the uterine tubes, the uterus, the vagina. I need you to know the different concepts because they may give you a question that the two gonads meet together to form a zygote. No, it's not true. It's not gonads, it's gametes. I need you to put that in mind. Now, as an overview, we have also the external genitalia, we have internal genitalia. The external genitalia located in the perineum, visible to the eyes, most of them, except the accessory ones in the female. While the internal genitalia are located in the pelvic cavity. You understand? The only exception is the testes and some ducts that descends down into the scrotum. Bear this in mind. Now we have something we call secondary sex characteristics. These are distinguishable features that you can use to distinguish the two sexes. All right? And also features that influences mate attraction. What do I see in this girl that attracts me to her? What do I see in this man that attracts me to him? These are secondary sex characteristics. Usually they develop at puberty, all right? Both sexes, usually pubic and axillary hair, you understand? Also some sense glands, and also the pitch of the voice becomes thicker for both sexes. Now, specifically for male, we have facial hairs, sometimes coarse and visible hair on the torso and the limbs, they become muscular, stronger. For females, distribution of body fat, breast enlargement, and finer and conspicuously body hairs. These are male sexual characteristics. Now, in terms of determination of sex, remember there are 23 pairs of chromosomes. 22 pairs are autosomes, that's body cells, and one pair is sex chromosome. That one pair can be XX for females and XY for males. All X carry the X chromosome, so X is default. So males produce half Y carrying sperm, half X carrying sperm. So if the Y carrying sperm meets the X and egg, it becomes XY. If the X carrying sperm meets an X, it becomes a female. Very, very important. All right? Very, very, very important for you to note. Now, another thing is sex determination. Like, how does the interaction between the genes and the hormones of the mother and the fetus work? Remember, initially, the default setting, the fetus is undifferentiated. You can't know if that fetus is a male or female. But in 5 to 6 weeks, gonadal ridges start to develop. These gonadal ridges gives birth to everything that in terms of features. All right? Now, around the gonadal ridges, there are two sets of ducts. One is the mesonephric duct and paramesonephric duct. Now, meso, male, meso, male, meso, male. How many times did I say this? 3 times. When I say meso, so know that mesonephric ducts develop into the reproductive tract of a male. So if this person is an XY, that's a male, the paramesonephric duct will degenerate, while the mesonephric duct will remain and develops all the reproductive tracts. But if this person is a female, what happens? The paramesonephric duct will remain, while the mesonephric duct will degenerate. Bear this in mind. Now, for a duct to degenerate, it depends on the SRY. There's something we call SRY, which is the sex-determining region of chromosome Y, found only in the males. What does this entail? Now, the SRY codes for protein that we call TDF. That's testis determining factor. All right? Put this in your head. TDF. So SRY codes for TDF. TDF does what? Interacts with other genes and initiates development of testis. In 8 to 9 weeks, testis starts secreting testosterone. Testis starts secreting what? Testosterone, TT. Now, the testosterone will now start stimulating the mesonephric ducts to develop into male tract. So they will ask you, what stimulates mesonephric duct? It is testosterone, produced when? 8 to 9 weeks. So differentiation starts around 8 to 9 weeks. How does the testis? What produces the testosterone? The testis. What encourages the testis to start producing testosterone? TDF, that's testis determining factor. What codes for testis determining factor? SRY, that's the sex determining region of chromosome Y. So all these things came into existence because the male gave an Y sperm to the female. Now, when the mesonephric ducts start developing, what happens? The testis will now go back. After producing the testosterone, it will now go back and produce what we call MIF, which is Mullerian inhibiting factor. This Mullerian inhibiting factor will cause the degeneration of paramesonephric ducts. I don't know if you understand. So testis produces testosterone and MIF. MIF breaks down paramesonephric ducts. Testosterone encourages the development of the mesonephries, making the person a male. For development of female, it results from the absence of androgen. There's no androgen at all. Not because of presence of estrogen. It has nothing to do with estrogen. Instead, it's just because there is absence of androgen. All right? Because estrogen is always high during pregnancy, so it has no meaning. You understand? Now, there's something we call intersex. There are different ways intersex can happen. You understand? About 1% of individuals are intersex. This intersex means the disconnection between the genes, gonads, and genitals. Males in some aspects, females in some aspects. So you see an individual having both male and female features, or high prominence of male features and low prominence of female features, and vice versa. Yet, they are carrying opposite genes. All right? Now, the different ways this thing can occur, in case of if you're asking your exam, is that 1, an excess fetus can be masculinized by abnormally high prenatal androgen exposure. We call this in AGS, that's androgenital syndrome. All right? If I'm talking too fast, please slow down the video. Now, and sometimes the determining factor, that's the SRY gene, can transfer, instead of being on the Y sperm, it will go and be on the X sperm. All right? This is a second way this problem occurs. Another thing is something we call AIS, which is androgen insensitivity disorder. In this instance, the individual is an XY, and the testis secretes what? Testosterone, but shows a feminine phenotype due to deficiency of testosterone receptors. This is exactly the feature we have in type 2 diabetes, receptor problem. So these are the three major ways intersex can occur. All right? Now we have gender, different gender, biological sex, like psychological, like gender is psychological, right? So psychological sense of masculine, feminine, or other sexual identity and sexual role. You understand? So this is what I'm going to talk about for now. So this will serve as an introduction to everything we need to know. I will want to jump into the questions and we look at these questions together. But before that, I want to show you a diagram. This diagram, if you look at it very well, this is the mesonephric duct. This is the gonadal ridge, right? Mesonephric duct, gonadal ridge. This is paramesonephric duct, 5 to 6 weeks. What happens? Immediately it gets to 7 to 8 weeks, it starts differentiating. For male, the paramesonephric duct will wilt or degenerate. For female, the mesonephric duct will degenerate. And from there, they form all these features. I want you to look at it critically and understand it. For development of external genitalia from 6 to 8 weeks, all right, we have the genital tubercle, we have the urogenital fold, we have the labioscrotal fold. All these things leads to things from 8 weeks, from 8 weeks, you start developing all these structures, which we will discuss later. So this is the background of our discussion. This is the background of our discussion. Every other thing is a very fast concept, all right? Now, we've discussed this, so I'll move down as quickly as possible. We discussed the structures of the testes. Okay, structure of the testis is located in the scrotum, contains seminiferous tubules, interstitial cells, or testicular nursing cells. It's always supposed to be cold. That's why it moved out from the abdominal region down to the scrotum. Why? Because the body temperature will not allow the testes to form. Instead, it goes down to the testes, to the scrotum, where the temperature is lower, 2 to 3 degrees and below, regulated by the cremaster muscle, the pampiniform plexus, and the dartus muscle. Very, very important for you to know. Also, we have the structures that is composed of the penile structures. One of them is corpus cavernosum, another one is corpus spongiosum, another one is glans penis, another one is prepuce. Now, in terms of this, they may ask you some questions such as the deep region of the penis surrounding the urethra that engorges with blood during an erection is known as what? Corpus cavernosum, spongiosum rather, not cavernosum, spongiosum. Now, let's look at some of the questions. One of the questions they may be asking you is sperm production. In terms of sperm production, the location is seminiferous tubules, process is spermatogenesis, maturation is in the epididymis, and it takes 74 days total. Bear this in mind. This is a lot of questions in one. The stages of spermatogenesis: spermatogonia is the primary spermatocytes. Primary spermatocytes become secondary spermatocytes. Secondary spermatocytes become spermatids, and spermatids become spermatozoa. So primary spermatocytes, secondary spermatocytes, spermatids, spermatozoa. Bear this in mind. Also, for the female reproduction review, the primary sex organ, as I mentioned, in is ovary, secondary is uterus, fallopian tube, vagina, tubes, and others. Now, the external is the vulva. You understand? Then we have the labia also. Now, the ovary structure, the outer cortex contains follicles, the inner medulla, blood vessels, and nerves. What are the supports? We have the suspensory, the ovarian, and the broad ligaments. Bear these 3 ligaments in mind. Extremely important because we will see some of the questions right now. Now, for female external genitalia, we have the mons pubis, labia majora, labia minora, clitoris, and vestibule. All right, I mentioned some of them initially. Now, the follicle development, we have the primordial follicles, we have the primary follicles, secondary follicles, tertiary follicles, and Graafian follicles. I want you to bear this in mind because we look at it. Also, these are just overviews. The average menstrual cycle is around 28 days. The phases are menstrual, proliferative, and secretory. MPS, menstrual, proliferative, and secretory. Now, the ovarian cycle, we have the follicular phase, which is 1 to 14 days, the ovulation phase, which is 14 days, and the luteal phase, which is 15 to 28 days. I want you to look at the diagram here. Look at the diagram here. All right? Look at the diagram. This is primary, secondary, tertiary, ovulation occurs, corpus luteum is formed. Then we have the involution, we have the albicans. So this is diagram. This is the ovarian cycle. We have the follicular phase and we have the luteal phase, all right? From 1 to 14 days is the follicular phase. The remaining days is the luteal phase till the next cycle. Now, the follicular phase is follicle, in terms of follicle coming out, maturing. So we have the primary, the secondary, the tertiary, and it matures, ovulation comes out. This is mature follicle, you understand, waiting for sperm to fertilize it. It forms the corpus luteum, causes involution, you understand, and comes out this way. And if sperm does not come, it breaks down and become menstruation. All right. Now here, this is menstrual phase. We have the menstrual cycle. All right. This is the menstrual phase. This is proliferatory phase. This is secretory phase. This is pre-menstrual phase. All right. This is the menstrual phase shading. This proliferative phase, it starts increasing again, like a bed that is waiting for a mature follicle to pee on it. All right. That's implantation. So if it doesn't implant, it will wilt out as menstruation from this area. So I want you to take time to look at it. These are the hormone that controls the menstrual cycle. This is estradiol, increasing, and dropping. Progesterone has taken over. It was low before, but from 14 days, progesterone goes high. And if the menstruation occurs, progesterone dies down, same thing with estradiol, and a new cycle forms. All right? Unlike here, where we have the follicle stimulating hormone, this is the FSH that stimulates this follicle to even occur. That's why it's high here. And when the ovulation is occurring, luteinizing hormone is at its peak. I need you to bear in mind these hormones. Very, very, very important. We are still going to discuss hormone in the next video, but bear in mind these movements. All right? That's why luteinizing hormone goes up and falls down here if immediately the primary follicle, new primary follicle is formed. You have to bear this in mind. This is extremely important. All right? I'm not here to discuss a lot of them, but just here to point out to you that we have the ovarian cycle and we have the menstrual cycle. There are two cycles: ovarian cycle, menstrual cycle. Menstrual cycle, we have the menstruation, we have the menstrual phase, the proliferative phase, and the secretive phase. While for ovarian cycle, we have the follicular phase, we have the ovulation phase, and we have the luteal phase. It's very, very important for you to know the difference. All right. Now, these are the key hormones. This estrogen, this progesterone. This is their function. Estrogen promotes secondary sex characteristics, stimulates endometrial growth, while progesterone is the one that prepares the uterus for implantation and also it maintains pregnancy. Bear this in mind. These two hormones are extremely important. Extremely important. Now, when you are talking about sexual response, male, we have excitation phase, we have plateau phase, we have orgasm phase, and we have the resolution phase, and we have the refractory period follows. Resolution phase is usually that phase where the penis is no longer able to rise. All right? But remember all these phases because these are the things they ask in questions. Now, I want to show you a diagram that will make you understand properly how these phases works. Males are very visual. You understand? So visual and the stimulation of the genitals. These two things, we go to the spinal cord, take sensation to the spinal cord, and from there, through the pelvic nerve, send an efferent through the parasympathetic signals to where? To the brain. Excitation occurs. You understand? This thing goes to the organ. Excitation occurs, deep artery of the penis dilates, leading to erection, the trabecular muscle. Okay. So men are very visual and also they react to visual and also to touch, especially stimulation in their genital region. If these two things occur, one of them occurs, it sends information to the spinal cord, which travels through the pelvic nerve, you understand, to the region of the organ. What happens there? Immediately it comes to the region of the organ, there is deep artery of the penis dilates, right? Leading to erection, leading to tissue engorgement with blood, you understand? And this is why the penis is this erect. Also, the trabecular muscles of the erectile tissues, they relax, allowing what? More engorgement. What is engorgement? Blood flowing into it. This leads to bulbar urethral glands secreting fluids. That also helps. All right? Now, that is the excitement phase. Now, for the orgasm phase, this is everything that occurs. The ductus differens, the exhibits peristaltic movement, pushes sperms that it got from the epididymis out to the urine, through the mouth of the penis. That's why we call the urethra, we call it urinogenital organ. All right. Also, seminal vesicles, the prostate, they secrete fluids, clear fluids. All right. This is very, very important for you to master this diagram. These are the neural controls, which I'm not going to discuss more, but the neural controls is very important in orgasm and also in resolution. For the orgasm, the prostate releases additional secretion. Seminal vesicles releases additional secretion. Internal urethral sphincter contracts. All these things happen as a result of efferent sympathetic signals. And also the bulbous spongiosum muscle contracts rhythmically, thereby pushing expelling the semen out of the mouth of the penis. This is what we call ejaculation. And after that, resolution occurs. That resolution, sympathetic nerve also takes care of it. All right? Internal pudendal artery constricts, reduces blood from entering the penis. And there's no matter what, the penis will not rise at that moment. Also, I need you to know the mechanism. Because this mechanism is exactly how Viagra works. Viagra is also called phosphodiesterase inhibitors. What is phosphodiesterase? This is phosphodiesterase here. It's something that degrades CGMP. What is CGMP? Now, when there is sexual stimulation, it leads to nitric oxide production. Nitric oxide catalyzes the reaction of inactive granulate cyclase to an active granulate cyclase. This granulate cyclase, once it becomes activated, what does it do? It catalyzes GTMP to produce CGMP. CGMP is what causes erection, vasodilation and erection, CGMP. Now, what phosphodiesterase inhibitors does is that it will inhibit phosphodiesterase from breaking down this CGMP, because usually CGMP, as it's causing erection, it will be degraded by phosphodiesterase to PDE5, leading to loss of erection. So these phosphodiesterase inhibitors, which is Viagra, we inhibit it from functioning, thereby maintaining further erection and further vasodilation. I need you to put this in mind, because these are the questions that they are most likely going to ask you. All right? Now, in terms of females, fertilization, remember fertilization occurs where? In the fallopian tube, specifically. Fallopian tube is those two arms, all right? It occurs in the fallopian tube, but implantation occurs in the uterus. So sperm penetrates the coronal radiator, acrosome reaction releases enzymes. These enzymes prevent further sperms from penetrating that particular egg, causing polyspermy. So we don't want polyspermy to occur. That's why the sperm produces the acrosome. All right? So if they ask you what stops polyspermy, it is the acrosome release by the sperm. All right? Very, very important. Now, pregnancy hormone, the first pregnancy hormone is HCG, human chorionic gonadotropin. What does it do? It maintains the corpus luteum of pregnancy. That's the first one, even before the progesterone starts increasing so much. That's why pregnancy tests, we ask you to go to do a urine test. That urine test can only detect HCG, can show positivity or negativity when the pregnancy is at least 7 to 14 days. That's when you see HCG. And immediately progesterone comes, the HCG drops. Usually, we also use this thing to check for ectopic pregnancy, because ectopic pregnancy, even after the progesterone has arrived, HCG will still keep increasing without reducing. All right? So I need you to bear this in mind. Now, the placenta functions as a nutrient exchanger, gas exchanger, hormonal production, and waste remover, because if we ask you, which one of the following is not the function of the placenta? The hormones that the placenta produces is estrogen, progesterone, HCl, that's HPL rather, that's human placental lactogen, and human chorionic gonadotropin, HCG. Very, very important. Now, there are 3 stages of labor. We have the dilation stage, that's the cervix dilating, full dilatation, that's 10 cm. We have the expulsion phase, that's the expulsion of the product of conception, specifically the baby. Now, the placenta delivery, this is the 3rd stage. So if they ask you how many stages, 3, placenta is delivered. One of the students was telling me in one of my classes, that placenta is eaten by some people. I don't know how that works, but they say it contains a lot of things. There is a scientific research going on about if the placenta is good for human consumption. All right? Now, breast development occurs specifically during puberty, pregnancy, and is determined by the adipose tissue. You understand? Remember, it contains mammary gland. All right? Extremely important. That's why sometimes we say breast is the same thing as mammary gland. Now, when you're talking about lactation, what triggers lactation? Prolactin. What ejects it? Oxytocin. First milk is colostrum, regular by 4 to 5 days. All right? Very, very important. These are landmine questions that they will ask you in your exam. prolactin, oxytocin, colostrum. Very, very important. Prolactin, produce. Oxytocin, pushing out. That is why there are some women that they give their baby breast milk and they have abdominal pain. Why? Because sometimes oxytocin still goes back to the uterus, thinking that that woman is in labor, and starts contracting the uterus. All right? As it is contracting the mammary gland, it's contracting the uterus, leading to pain, abdominal pain for lactating mothers. Why is breastfeeding very important? It leads to easy digestion, perfect nutrition, antibodies for immunity, also helps to clear meconium and promotes bonding. They will ask you, one of the following is not the benefit of breastfeeding. What are the changes that happen during aging? Testosterone falls, male climacteric, changes in libido drops, prostate enlargement. That's why from 40 and above, we start telling you to check for prostate. You go to the hospital, we do bimanual examination to see if the prostate is enlarged. Also, we tell you to also do the prostate-specific antigen, PSA. Very, very important, because men are always predisposed to prostate enlargement and prostate cancer. For female, they have menopause. What is menopause? Pausing of everything. Egg has finished, because women don't produce new eggs, so eggs finished. There's decreased lactogen. The women start having hot flashes. It shows end of fertility, and there is vaginal changes. All right? These are the things that they will ask you in your question. What are birth control methods? We have the hormonal, we have the barrier, we have the surgical, we have the natural family planning. Also very important for you to know. Now, what are the reproductive disorders? Infertility for male. Infertility can involve a whole lot of things. It can be that the man is not producing enough sperm. It can be that he's producing enough, but those sperms are not motile. All right? It can be the morphology, the shape of the sperms is not going to cause reproduction. All right? So there are a lot of things that cause male infertility. For female infertility, it can be that the person has blocked, ovary, that the ovary is not producing mature egg. It can be a whole lot of things. It can be that the fallopian tube is also blocked, so there's nowhere the egg is moving. Also, there's something called endometriosis. Endometriosis is when you have the endometrial lining inside instead of on the surface of the uterus. So when the person is seeing her period, you understand, the person is also seeing period in the inside of the muscle of the uterus, thereby leading to pain. Also, it may not necessarily be the uterus, it can be any other place. If the endometrial lining of the uterus is found any other place, that place will also be seeing its period at that point, leading to periodic pain. We have PCOS, polycystic ovarian syndrome. This is another concept that you know on a later date. All right? Now, what is the sperm pathway? Seminiferous tubules is produced, immature sperm. The red testis takes it, sends it to epididymis. Epididymis matures it, stays almost 74 days. You want to have sex, vasa differential takes the sperm from the epididymis and sends them out through the ejaculatory ducts into the urethra. This is the pathway. I need you to memorize it because they will ask you. For the egg, there's production, ovary produces, the egg moves straight to the fallopian tube. From there, it fertilizes, then falls into the uterus. If it's not fertilized, it goes out through the vaginum as period. How is male reproduction regulated? A lot of hormones, FSH, LH, testosterone, inhibin. You understand? We have the GnRH. I've discussed this in the beginning of this slide. So in this discussion, please, I want you to go back and look at it again. All right? Now, for female, we have the GnRH, follicle stimulating hormone, luteinizing hormone, estrogen, and progesterone. Very, very important for you to know these hormones. During puberty changes, you understand, for male, we have the sperm production, we have the deepening of the voice, genital enlargement, body and facial hair growth, muscle mass increase. Very, very important for you to know these changes. For female, breast development, hips start widening, body hair growth, menarche, that's beginning of menstruation, and regular cycles begin. All right? Now, for erection, I've already discussed this. We have the parasympathetic response, we have the nitric oxide release, we have the arterial dilatation, we have the venous compression, and we have the blood trapped in the corpora spongiosum. Very important for you to know the erectile mechanism, because this is how they will give you this sequence, and you need to memorize this sequence. Very important. Now, in terms of meiosis, We know, I'm not going to go into this, but you know that because I'm not treating genetics, this is anatomy. And anatomy is location, location, location. So for meiosis, there's reduction in chromosomal number, creates from diploid to haploid, creates genetic variability, variety, different timing in males and female, and essential for gamete formation. Also very, very important. Now, semen composition, 5% volume is sperm. Just 5% is sperm, millions of sperm. Others are 60% seminal vesicle fluid, prostate fluid, and bulbourethral fluid, because they will ask you, what are the things that gives fluid to the sperm for movement, easy movement? Tell them that it's seminal vesicle, prostate fluid, prostate, and also the bulbourethral gland. Extremely very important for your knowledge. If it's for the female, we have the vaginal lubrication, natural lubrication. How does it happen? When the clitoris is engorged, all right? Uterus is elevated. You understand? Leading to breast changes and multiple orgasm becomes possible. For males, they have orgasm usually once during sex. For female, they have multiple orgasms. Some are aware of it and some are not even aware of it. So male sexual responses, penile erection, testicular elevation, emission, ejaculation, and refractory period. We discussed this, I showed you in the diagram. All right? Now, menstrual period, rising of FSH, follicle development, endometrial proliferation, and others. All right? Also very, very important. We have the uterine changes. I've discussed this as well. We have early developments, cleavage division, morula formation, blastocyst formation, and implantation. Also very important for your knowledge. All right? Now, we are going to see questions pertaining to this. When you're talking about the prostate is just like a golf ball. Just like this, like a golf ball. All right? Yeah, location is below the bladder, produces fluid. We've discussed about it a lot, and least may enlarge with age. We've said initially. Vasa differential is 45 cm, very long. That is what carries the sperm from the epididymis out to the urethra. So the function is sperm transport. Location is spermatic cord, surgical site for vasectomy. So when we want a man to stop fertility, we do vasectomy. That's we tie the vasa differential, all right? Because they will ask you. Now, the blood supply for male, we have the testicular arteries, we have the pampiniform plexus for female. Also, we have ovarian arteries, we have the uterine arteries. Now, for the mammary gland, we have the alveoli, lactiferous ducts, lactiferous sinuses, and the nipple. We are going to discuss this later. Pregnancy testing, we detect HCG in the urine 6 to 8 days after fertilization, peaks at 10 days. I've already told you about this. Barrier methods, we talk about condoms, diaphragms, cervical caps, spermatocytes. Extremely very important for your knowledge. Signs of pregnancy, early signs, you miss your period, nausea, vomiting, breast tenderness, fatigue, early morning sickness. All these things are early signs of pregnancy. Now, when we are talking about infertility, I've also discussed it. It can be low sperm count, poor motility, abdominal morphology. Very, very important for you to know because you will be working in the clinic. We have emergency contraceptives, which we give within 72 hours to prevent ovulation, to prevent fertilization. But it's immediately these things are called emergency contraceptive does not work because it's not an abortion pill. To prevent STI, barrier methods, regular testing, communication, and the most importantly, abstinence. Abstinence is very, very important. We've discussed the disorders like endometriosis, PCOS, prostate enlargement, and erectile dysfunction. Very important for you to know. How do you check all these things in male? Semen analysis, hormone levels, ultrasound, and genetic testing. Also very important for you to know. Some of the important numbers you need to know is that count is greater than 20 million, cycle length is 28 days, pregnancy is 40 weeks, puberty is 8 to 13 days. Also very important for you to be aware of. So these are very, very important. We've reviewed the concepts. I want to review the questions for you. Please pay attention to these questions. And as you're paying attention to these questions, I want you to look at these diagrams to be able to understand exactly what we're talking about. Now, some questions will be like, which of the following is generally accepted as a secondary sex characteristics? We've discussed secondary sex characteristics, and one of them is breast enlargement. So if somebody tells you the vagina, the uterus, the prostate, presence of testes, they're secondary sex characteristics? No, they are not. I want you to be mindful of this, please. Which of the following primary sex organs? We've already discussed that. For females, it's ovaries. For male, it's testes. So you can't be deceived. Which of the following is secondary sex organs? Vagina, all right? So whether an organism is genetically male or female is determined by what? The sperm. We've discussed that, which is the X sperm and the Y sperm. We discussed about SRY. So now, another thing you need to know that an individual will always have male physiological characteristics. An XY individual. It's not true, because there are some times when somebody can be XY, but we have female physiological characteristics, which we've discussed initially. So the answer is false. Don't be deceived that somebody is XY, is a male, we agree, but may not show male physiology. Now, another question like that is, the presence of Y chromosome guarantee the development of male secondary characteristics? Not true. There are a lot of things that guarantees that, not just Y chromosome. So the testis development factor, which we've discussed, what gene codes for it is the Y. The penis is homologous to what? The clitoris, all right? Which is also an external female genitalia. Remember the things that keeps the male cool. Remember, countercurrent mechanism is one of them. Pamphiniform plexus. Please remember. Also, the gonads, when do they start developing? After fertilization, when do they start developing? Gonads. We say 5 to 6 weeks. Before then, they are undifferentiated. The descent of the testis is stimulated by what? By the testosterone. Remember, the testis descends downwards following the gubernaculum. I told you, for people that have ever been in my class, that the gubernaculum is just like a tour guide, holding the testis like this and leading it down to the scrotum so that it will not miss its pathway. And remember, I told you that that space that is created leads to what? Hernia in some childs. Now, the urethra is very important for you to know that the penile urethra is enclosed by corpus spongiosum. Corpus spongiosum, not cavernosum, spongiosum, like a sponge enclosing it. Bear that in mind, because that is one of your questions. All right? Also know that the nurse cells secrete inhibin. Yes, it secretes inhibin. And what is the function of this inhibin? The inhibin regulates the rate of sperm production. It regulates it so that you don't produce too much. It is the nurse cells that secrete inhibin. And also the scrotum contains the testis and the spermatic cords. Very, very important for you to know. Now, let's go back to more about the muscles of the penis. It's also very important for you to know that the deep region of the penis surrounding the urethra that engorges with blood during an erection is known as what? Corpus spongiosum. So spongiosum surrounds the urethra. It is where blood engorges so that the penis becomes erect, not cavernosum, not scrotum. When it is cold, the cranial muscle contracts and draws the testes closer to the body to keep them warm. Just draws it to the body. That's why the penis always reduces most times. Another thing that helps countercurrent mechanism is the pamphiniform plexus. I've mentioned this. You can't forget. Now, something else you need to know is that there is something we call blood testis barrier. The function of this blood testis barrier is to prevent antibodies in the blood from getting into the germ cells. Because if they get into the germ cells, it can be a problem. All right? It can be a problem. In terms of thermoregulation, we talk about the cremaster, we talk about the piniform plexus of the veins, we talk about the countercurrent mechanism exchange, then we talk about the datus muscle. I'll take it again. The cremaster, countercurrent mechanism, that's CC. Then D, the datus, then the P, piniform plexus. Cremaster, countercurrent, datus, piniform plexus. P, CC, D, P. Which cells produces testosterone? I discussed this. It's the interstitial cells of the testis. All right? That is what produces testosterone. Which part of the penis has the external urethral orifice? It's the glans. Remember, the glans. I should have put a picture of the penis in this discussion, but another discussion I will put the picture of the penis. This is a rapid review, as I mentioned initially. What innervates the penis? It is the internal pudendal vein. Internal pudendal nerve. Internal pudendal. I will sing it. That's one of the nerves that they will definitely ask you. Now, the part that matures sperm and stores it is where? The epididymis. Remember, the spermatic cord is just carrying a lot of things that passes through them. But the red testis carries sperm from spemiferous tubules to epididymis. And it's immature sperms. But in the epididymis, it spends almost 74 days to mature and sent to the ductus deferens to take to the urethra during sex and push out expulsion. Now, the pathway. I told you this pathway, extremely important. The correct pathway of sperm cells from their formation to ejaculation. Formation seminiferous tubules sent to red testes, then to epididymis, ductus deferens, ejaculatory duct, then urethra. Does it make sense? Yes. The ejaculatory duct is just the duct that connects the vasa deferentia to the urethra. Very important for you to know. Maturity, epididymis. Maturity, epididymis. And that is ejaculatory duct. They pass through the prostate gland. So if you ask which duct of the male reproductive system passes through the prostate, tell them it's the ejaculatory duct. Very, very, very important. Now, another thing you need to know is that there are a lot of things that produces fluid, but the seminal vesicle produces 60%. That's most of the semen that is produced. Seminal vesicle. Remember, prostate produces, remember, bulbar urethral glands produces, but seminal vesicle produces the most, 60%. Now, when they are telling you about the organ that is found lateral to the membranous urethra, they are talking about bulbar urethral gland. Very, very important. The prostate is golf size, correct? So anytime you hear golf size, don't read the option, pick prostate. All right? How many prostate does a man have? One. We have one prostate, which can be enlarged. But know the advantage of the prostate, it contains a lot of fluid and a lot of duct. Now, some people will be like, when somebody comes to the hospital and is telling you, hey, doctor, I cannot urinate. I'm having pain when I'm urinating. What are you thinking? Ask the person's age. Take history about the patient. Ask the patient's age. If the person of age has prostate, get the prostate examined. Why? Because the prostate is compressing the urethra. Remember, the urethra passes through the prostate, right? So the prostate is just like this, a bulb around it, like golf bulb around the urethra. So it can, if it gets enlarged, it will compress the urethra. And urine passes through the urethra. So the person will not be able to urinate or have extreme pain and bleeding during urine. What is function of the FSH and luteinizing hormone during puberty? It is for enlargement of the testes, usually in males, enlargement of the testes. While testosterone stimulates development of secondary sex characteristics, spermatogenesis, and libido. That is testosterone. So if somebody comes to the hospital and complains that he's not having enough libido, please do hormonal assay and check the testosterone. And the testes start secreting testosterone usually in the first trimester of fertile development. Very, very important. First trimester. All right? And testosterone helps in development of male secondary sex characteristics, as I've mentioned before. Testosterone, specifically. If they ask you an androgen, still tell them it's testosterone. Everything is testosterone. Testosterone is very important. And when they tell you, the question I mentioned initially, that DASH stimulates the interstitial cells of the testes to secrete DASH. It is luteinizing hormone that stimulates the interstitial cells of the testes to stimulate what? Testosterone. Still ends in testosterone. Very, very important. Androgen, testosterone. Now, remember, inhibin is also produced. Why? Because it suppresses spermatogenesis without affecting testosterone secretion. So inhibin affects spermatogenesis. Also, I need you to know that the gonadotropin releasing hormone is inhibited by the testosterone. Very, very important. The knowledge of testosterone is very important. Very, very important. Now, if they're asking you about changes in puberty, talk about deepening of the voice for men, gaining of muscle, acne, growth of the scrotum and the penis. It gets bigger. All right? These actually what results from puberty. Now, some people would say that, oh, erectile dysfunction prevents ejaculation. In most cases, it's not true. Erectile dysfunction is just erection. It has nothing to do with ejaculation. All right? What is climacteric changes that we discussed? I mentioned these climacteric changes initially when I was talking about aging in males. Climacteric changes is the decreased secretion of testosterone. Now, let's talk about meiosis. What is the most important role of meiosis in sexual reproduction? Meiosis. Remember, meiosis prevents the chromosome number from doubling in each generation. Very, very, very important. Very important. It prevents it. So that's why it starts with haploid and ends with, it starts with diploid and ends with haploid. And what is the last stage of meiosis? Spermatogenesis? No. In case of if they ask, please don't be deceived. And only germ cells undergo meiosis. Only germ cells. If they tell you body cells, tell them no. And remember, in each meiosis, what happens? Each parent produces what? 4 haploid cells. 4 haploid cells. 4 haploid cells. Extremely important. So at the end of meiosis 1, there are dash cells, 2 haploid cells. Whereas at the end of this 2, there are 4 haploid cells. I need you guys to know the difference between this. Another question will be, at what stage does a developing sperm cell begin to grow a tail? It is in the spermatid stage. Remember the stages I mentioned? Please scroll back to the slide and look at it, or to this video and look at it. All right. The first haploid stage of spermatogenesis is prophase 2. Remember, an haploid results of meiosis 1 is called a secondary spermatocyte. Meiosis 1 ends in secondary spermatocytes. Now, for spermatogenesis, spermatids become spermatozoa. Spermatids, spermatozoa. I want you to know the sequence. And this process of spermatogenesis, and spermiogenesis, it begins with germ cells and ends with 4 gametes. Also, I want you to know that the primary spermatocytes have 46 chromosomes, whereas the spermatids have 23. The spermatids have 23. Secondary spermatocytes divide to form what? Spermatids. So you understand. We remember we discussed the function of nut cells. What are the functions of nut cells? They secrete inhibin. They secrete androgen binding protein. They protect and support the germ cells. And their target junctions form the blood-testis barrier. But what do they not do? They don't secrete testosterone. Bear that in mind. Inhibin does not secrete testosterone. It doesn't. Remember what secretes testosterone? I've told you. Now, I discussed the acrosomes for you. It contains an enzyme used to penetrate barriers surrounding the ovum. How many percent is sperm? 5%. I discussed it with you. 60% seminal vesicle. Then others. Another thing you need to know about sperm cells is that sperm cells, they have power for movement. How do they get this power? From fructose. And this fructose, where do they get it from? From seminal vesicle. You need to be aware of this. And when you're talking about infertility for male, it's inability to fertilize an egg. Inability to fertilize an egg. And this is usually when a sperm count is lower than 20 to 25. That's complete infertility. Complete infertility. 20 to 25. When we are talking about neural mechanism of erection, remember, neural mechanism is an autonomic reflex that's predominantly mediated by the parasympathetic nerve fibers. Parasympathetic nerve fibers. That's why I showed you the diagram. All right? Why the sympathetic nerve fibers are not the ones that trigger the secretion of nitric oxide? They are not. It is the parasympathetic. Parasympathetic. All right? For erection. Remember, parasympathetic also helps in terms of urination. It also helps in terms of digestion. But remember, parasympathetic is rest. All right? Just put this in your mind. Just an abstract. Now, dilatation of the deep arteries causes the cavernosus spaces, cavernosus spongiosus specifically, to fill with blood, penis to become erect. Deep arteries. Deep arteries. Sorry. Now, the orgasm phase, which I showed you of male sexual reproduction, is stimulated by the efferent sympathetic signals from the lumbar region of the spinal cord. Remember, the orgasm emission is by efferents, correct? By the efferents. Why the neural mechanism of erection is autonomic reflex, which we just discussed. I need you guys to pinpoint the differences in this discussion so that you won't have a problem. And during the peak period of respiration, blood pressure and heart rate will climax. That is orgasm. Viagra, what does Viagra do? Viagra inhibits degradation of CGMP, that's phosphodiesterase inhibitor, to maintain erection. Genetic males is XY and genetic females is XX. Bear this in mind. Another question they can ask you is this diagram, this diagram is what they can ask you. Please remember which part is the seminal vesicles. Remember the epididymis. Then remember the vasa differential. Very, very, very important. This is the tunica. Why this is the tunica vaginalis outside? All right. This is the red testis. You see how it looks like African hair. This is the red testis. This is the epididymis. This is the tail. This is the body. Very, very important. Why this is the vasa differential. This is the spermatic cord. This is the blood vessels and the nerves. This is very, very, very important for you to know this diagram, because they may give you this diagram in the exam and they will label red testis, they will label seminal vesicle, they will label tunica vaginalis and tunica albuginea, they will label epididymis, and they will label the vasa differential. It's very, very important for you to know which is which. And they will ask you, for example, they may tell you which part is for maturation. Remember, the part for maturation is the epididymis, and you should know the structure of the epididymis. They may ask you, where is testosterone produced? Very, very important for you to know. They may ask you which structure is generally called to sterilize a male. Remember the vasa differential. All right. Another thing they can give you is the structure of the penis, where they may be asking you things like the part that produces fructose, which I just mentioned initially to you. All right. And fructose helps for the movements in association with the flagella. Another question they can ask you is which side is the ejaculatory duct, or which side produces the pre-ejaculatory semen. All right. These are the things you should know. Also, you need to know the diagram of the penis, because they will ask you the different parts of the penis. And also know the muscles, like the corpus spongiosum and the corpus cavernosum. Extremely important for you to know. They can ask you which part is circumcised. All right? This is something also that you need to know. So, I want you to go through the diagram of the penis. I'm not able to get the diagram, but I want you to go through the diagram of the penis specifically because it's something that will come out in your exam. All right? Now, remember, the seminal vesicle produces the most semen. It produces the most semen, and the secondary spermatids divide to form, the secondary spermatocytes divide to form the spermatids. Very, very important as well. If they ask you, dash has no androgen or receptors and do not respond to any androgen or receptors, it is germ cells. They don't respond at all. And remember that the secondary spermatocytes is the result of the meiosis 1. It's haploid. Result of meiosis 1, secondary spermatocytes. Result of meiosis 1, secondary spermatocytes. Very important. Remember the mechanism that keeps the testis cool? Go and look at it. Go back and look at it. Where does the sperm cell reach maturity? Go and look at it. Epididymis. Very important. All right? So all these things are so important for you to know. And this, a whole lot of questions we've treated so far. Remember the deep arteries. Remember what produces the sperm and the egg. Remember what inhibin is, which hormone suppresses spermatogenesis, which is the inhibin. Remember the function. Remember the primary spermatocytes. Remember the spermatids, which have 23. While the primary spermatocytes have what? 46 chromosomes. Spermatids, 23. I've mentioned this before. Remember the function of the ductus differential. All right? Remember what controls the autonomic reflex. And remember what produces the zygote and the egg. Remember the seminal tubules, the red testes, the epididymis, the ductus differential, the ejaculatory duct, the urethra, which is the pathway. This is the movement. This is how sperm moves from production to ejaculation. Very, very important. So we've been able to discuss a lot of questions. Despite the fact that I didn't number these questions, the questions we've discussed are a lot. So I want you to take time and review this. I try to make this just less than an hour for you to be able to focus and concentrate. I will also bring another video, which is the endocrine system. All right? So I want you to look at it. Take your time. Look at it. As a conclusion for this slide, I want you to remember things like contrasting and comparing the colostrum with breast milk, discussing the benefit of breastfeeding, because that's what we've discussed. Mechanism of ejaculation, all right? Breast development and contraception. These are the things we discussed, and these are the things that we definitely come out in your exam. All right? Also, remember the childbirth. You understand? The fetus normally turns into the head down vertex position. I didn't discuss this, but remember that. Extremely important for you to know. All right? The uterine growth and the weight. The uterine weighs are 900 grams at the end of pregnancy, 50 grams when not pregnant. So thank you so much. Thank you very much for watching my YouTube channel. This video is very short for you to digest and understand. All right? Remember, as I said, take your pen and paper and write down everything I've mentioned. This is called AOC, area of concentration, for your exam. Even if it is your college exam, your biology college exam, it's very important. That's your AP1, AP2, extremely important. NCLEX, important. USMLE, important. These exams this video will prime you for these exams. Take your pen and paper, write it down. Most importantly, remember to follow the channel, subscribe, and make comments. I want you to make comments. Ask any question. Tell me the topic you want me to discuss. And I will be able to streamline questions that will guide you for you to be able to be successful in that exam, in this exam. So for reproduction, this is where we come to the end. I'll still put other video up for reproduction, but this is a rapid review for your exam. This is a rapid review for your college exam. For people writing AP1, AP2, it's very important. For people writing NCLEX, extremely important. For USMLE, extremely important. These are pointers, pointed questions. All right? Anything I mentioned is potential question that is coming out in the exam. And I really want you to take your pen and paper, review this thing, watch this video as many times as possible. Send it to your colleague in every colleges in the US and outside the US. Send to your colleagues. Very, very important for you to send to your colleagues. All right? Don't house this information alone. Don't keep it in your head alone. Send it out to them. Tell them that it's very, very important.